Hi everyone, welcome. I'm Dr. Partha Nandi. For those of you who don't know me, we are talking about an important subject today and near and dear to my heart, which is measles. And big story today, outbreak, in certain parts of the United States. So we're talking about measles and what you need to know. And thank you for joining us today. I appreciate it. Listen, this is a pretty controversial topic because lots of people have strong feelings about the immunization against this disease. And I have a definite opinion as a doc. I really am pro-vaccination. I think it's 97% effective. And I think that, we should really immunize our kids. And I think that's the way you prevent this. Remember, this can be a lethal disease. So I appreciate all of you joining us. So whatever your opinions are, let me know and how we can help. Our whole idea is to be able to serve their community, to let them know. And if you think this is something that's useful to you, something that's beneficial to you, then share it with your community, because that's how we spread the word. That's how people can really can get the word out for people who can benefit. So I appreciate all of you joining in. When you join in, and let us know what questions you have and where you're calling us. Right? Where you're joining us from. So it's really pretty cool. We're very open-minded. Whatever you want to ask us, we'll do our best to answer it, right? So first of all, what the heck, right? What the heck is measles, right? Measles is an infection, and we didn't really talk about this because we got it pretty well controlled, but now it's coming back. So measles is essentially a childhood illness caused by what? A virus. Very contagious, by the way, very contagious virus. Death rates from measles have been really falling worldwide, but the disease, get this, kills more than 100,000 people a year. So no joke here. 100,000 people a year still, even with everything that's going on. Most people who die under the age of 5. So when you have measles, what's the deal? What is actually what kind of problems do you have? So typically about 2 weeks. You have this incubation period, 10 to 14 days. You get exposure and you don't really have too many symptoms, right? And then what happens is that you can get some symptoms of measles. And those symptoms are fever, dry cough, runny nose, sore throat, inflamed eyes, and this rash, like these large kind of blotches that flow into one another. So it's important to know that you can get those fevers, dry cough. What is that? It's pretty non-specific, but here's why we care so much about it, that you can get complications from this. People can die, right? Ear infections, bronchitis, pneumonia, swelling of the brain, which is encephalitis, and people that are pregnant can really need to take special care, right? So you want to make sure that that if you're immunocompromised, any problem with the immune system, cancer, you get to your doctor right away. So what's happening is that more and more people are getting this illness, and I think a lot of folks are not are against vaccination, right? So for many reasons, there's lots of misconceptions. Lots of quote unquote health leaders are saying that this is something that should not be given. So you really have to take into account what is actually happening. The MMR, right? That's the vaccination we give for measles. 97% effective. 97%. 3% are still not effective. So you still are at risk if you are exposed to someone who has measles, but it's a small chance, right? So you're talking about 97 out of 100 folks are protected. So really have to make a concerted effort to get everybody immunized. But why we're worried about this is that they have 53 confirmed cases in Rockland County, New York. I mean, that's a big deal. And where I reside in the Detroit metro area, there 33 cases so far compared to 19 last year. It's still a big deal because it's increased from previous, but it's not a state of emergency. But I'm really, really worried about this because if you look at the statistics, the Center for Disease Control, CDC, said that 1 in every 20 children who get measles will get pneumonia. 1 in 1,000 or 1 in 1,000 kids will develop swelling of the brain. And of that, one or two children out of 1,000 will die. So this is a serious problem. And it really goes to the point as, what are we going to do, right? We have an opportunity to protect people. We have an opportunity to be able to immunize and protect kids who are most vulnerable from this infection. We're not doing that. And this is we're talking about this stuff because it wasn't, a couple years ago it wasn't a big deal. Now it's becoming a big deal because so many folks are deciding not to immunize their kids. So that's a real problem. Listen, I love all of your comments, and tell me where you're joining us from. I know that Cappy, Cecile Frangella from Windsor, Ontario, thank you for joining us. Carolyn Patton. By the way, I have a link here for my Health Hero community. If you really are into what we're doing, and we'd love to be able to do special broadcasts for our Health Hero community, I've got the link right there. Please, join our Health Hero community. And those of you who are on ManyChat who joined us through ManyChat, please message us if you have any questions as well. We did an announcement on ManyChat to announce this broadcast. So, Carolyn Patton, thank you for joining us. Catherine Reardon, how you doing? Frank Murphy, awesome. Thank you for joining us. And Catherine is from Lompoc, California, in Santa Barbara County. Awesome joining us. Roberta Ancona, awesome. Roberta is an incredible individual. She and her husband helped us so much with my dad's golf outing charity, and super human being. Angela Bush, thank you for joining us. Callie, thank you. Aranazu Placencia joined. Sue Mason Wilson from Ottawa Lake, Michigan. Please, folks, get your kids vaccinated. You're absolutely right. And it's not just a theoretical problem anymore. You saw the number, you saw what I said, 53 confirmed cases in Rockland County. So, the problem is that 97% effective the MMR. And for those of you who don't know anything about this vaccination, you want to make sure that you get this, you get your kids vaccinated. The first dose for infants is given between the ages of 12 and 15 months, and the second dose between ages 4 and 6. If you've been immunized, you should be good, but still that 3% chance. We need to decrease the number of cases. Why is that? Because there's something called herd immunity, right? So you get less and less folks out there, less and less, cases to spread, right? That's the idea. You want to get it so hardly anybody has this disease, so you can't spread it to others. And there's lots of talk about, this is really not, the immunizations are all fake and et cetera. It's really not. Once you see these folks who are not immunized, they're getting infected, and it's a public health concern. And here's what happens is that, of course, we don't want to infringe on anybody's rights, right? Everybody says, listen, I have my rights. But what happens is that you're exposing the entire population when you go, and this is an incredibly contagious illness. And for 10 to 14 days, you got nothing, right? You got nothing. And then you start developing problems, and people can die from this. So no joke, So the problem is that, Laura says, where is this 100,000 coming from? I can't figure. I'm not sure what the 100,000 means. You got to clarify for me, Laura Kieltkia. Angela Bush says, please let people know vaccinated are getting the measles as well. Angela says, please let people know vaccinated are getting the measles as well. It's not the unvaccinated spreading it. Angela, I would disagree with you. 97% effective. That means that, 3 out of 100 people who get vaccinated will get the disease. But if you don't get vaccinated, it will be far more. Samantha, how you doing? So good to see you. Sam is an amazing individual. She's awesome. Thanks for joining us. Peggy Pisoni. Angela Bush says, we're not against vaccinations. We're fighting for safer vaccinations. Awesome. I agree with that. But the problem is that, if you say that should not vaccinate until we get the ultimate safe vaccine, then we're gonna have kids that are dying, Angela. That's the problem. Ron Richardson. Catherine Reardon says the measles were removed from having it because the lie that it causes retardation. It does not cause that, or autism. I think that you're talking about the vaccination. A lot of people thought that getting the vaccine can really give autism. That has been debunked. The person who said that or published that said actively that they made up the results. We got to get that straight. A lot of people worry about that can cause autism. I respect those who who are out there, they're trying to fight for a safer vaccination. I think that's great for every medicine that we give, right? So any of you who've taken Tylenol know that if you look enough, there are going to be people who have side effects from Tylenol. It doesn't mean that it's an unsafe drug. It just means that there are a certain number of people who are going to have side effects from it. It doesn't mean that you throw the baby out with the bathwater. It doesn't mean that it's not effective. We have been able to effectively fight these diseases, infectious diseases, with vaccinations. If I ask somebody, what did people die, right, in the early 20th century? What do you think people died of? I mean, infections. Infections. I mean, we had pandemics of infections that killed millions upon millions of people. We just don't want to go back there because we were saying, oh, well, you know what? We have people spreading information that's really not true. So I appreciate it. And if you think this is important, please share this with your community. Again, I'm not against anybody who wants safer vaccination. I just don't want people to say, don't vaccinate your kids and just, whatever, you just let Mother Nature take its course. I mean, people could die from this, and it's unneeded. If you could see what we do as physicians, what lengths we go to save one life. I mean, it's just such a tragedy. We can prevent illnesses and deaths, and we're not doing it because the fact is there's a lot of folks that are quote unquote health gurus that are out there saying this stuff. Again, today we're talking about measles, a very, very contagious disease caused by a virus. Why do we worry about it? Because it can really wreak havoc. It can give you fever, cough, runny nose, sore throat, and a rash, but complications can kill. You can have brain swelling, you can have pneumonia. So, really, really important, very important to know that. It's not just a joke that, oh, I'll just be all right, because people can die from it. And why are we talking about today? 153 folks, right, in Rockland County, New York, had confirmed cases, 153. Where I live in the suburbs of Detroit, Michigan, 33 reported cases compared to 19 last year. So we've got to take a handle. We've got to educate people and say, we've got to be able to do something about this, right? So let me keep answering some protections. Laura Hiltka says 97% are quote unquote protected. How many are having reactions to this vaccine? Measles is a side effect from MMR, which causes literally every single thing you're telling us to worry about from the measles. It just is not correct, Laura. What happens is 97% are protected from this vaccine. 97% don't get the effects of measles. All my kids have been vaccinated. They did not get side effects. There are millions of kids who got vaccinated, did not get side effects. Am I saying that there are no possible side effects from this? No, I'm not. What I'm saying is that of course we got to do better, but that's every drug, right? There's a risk versus benefit, but in this case, the benefits far outweigh the risks in this case. We cannot take a chance on having kids die while we're waiting for the perfect, concoction of 0%. If you have a drug, I'll give you an example that millions upon millions take. And if you have a 0.1% chance of a reaction, so let's just do the math, right? So 1 million people, 10% would be 100,000, right? What would 1% be? It'd be 10,000. 0.1% be 1,000 people. So if 1 million people take it, and 0.1%, I think it comes out to about 1,000. It's a lot of people. But 99.9% of people will not have that reaction. We've got to put it in perspective and not look at the small numbers that could have problems. I'm not saying that's not important, not at all. But the problem is that we have got to be able to say that we cannot allow kids to die while we're sitting there and just spreading some misinformation. That's all. Yeah, Catherine Reardon said, get vaccinated, and it's called MMR. Absolutely. Kelly Frey, hello, how are you? Where are you from? Kelly Patricia Roy Balloon, how are you? Please tell us where you're from. And Angela Bush says, we need to hear all sides of the vaccine story. Absolutely, and that's why we're doing this broadcast. But I'll tell you, when you have a county in the United States of America, 2019, with 153 confirmed cases, it's time to talk about this as a real disease. I mean, we don't want it to be in the thousands and the hundreds of thousands before we start saying, oh, maybe we should do something about it. We've got to be proactive and say, listen, as docs, we are trying our best to educate, but clearly it's not working, right? I mean, I think a lot of people are getting vaccinated, but there are significant numbers who are not. So we've got to be able to put this out and not and Angela Bush saying the vaccinated are the ones getting the measles is just not true. Angela, it's not true. You have a 97% risk of a 7% chance of preventing yourself from getting the measles, but there are that 3%. Yeah, are there the 3% that could get it? Absolutely, they can. 3%, but the 97% are protected. Sophia De Napoli, thank you so much. I appreciate you joining us. And Angela Bush says 70,000 vaccine injured a year. I would like to see that information, but then I would like to know how many were not injured. Over how many millions? Like I talked about, when you talk of numbers like that, if you talk about an injury, does that mean that they had a red mark? Did they have an itch? Did they have a rash? Did they have something else? And here's the thing, that you have to look at the other side, right? If you say that 10 people fell off, a chair, but then 10 million did not, there's going to be a percentage of people with any drug that's going to give side effects. So Laura Kilka says, 100,000 people who said get measles every year. This is worldwide. Worldwide, right? If you go to the site, if you go to, I'll give you the site. It's Mayo Clinic, right? Mayo Clinic. This is from the MayoClinic.org. So while death rates have been falling worldwide, the disease still kills more than 100,000 people a year. This is worldwide. So, how many billion people live worldwide, right? So you have to look at that and say, there's still a crisis. There's still people who die from this. This is not some hoax. This is not some made up story to sell something. It really isn't. I'm not getting compensated by any pharmaceutical company for the MMR. This is nothing. This is me knowing that I have kids. I don't want other kids to die. Plain and simple. That's how it is. So Catherine says, I'm vaccinated. My son is vaccinated. Dawn Sunrise says, what age should an adult get booster now that it's not eradicated? How do we know how long our childhood vaccination is active? Dawn, if you have been vaccinated with the series, you should be okay. Check with your doctor if you're immunocompromised, if you have any special situations, but if you've been immunized as a child, you should be okay. Laura Kilka says, but you aren't required to take Tylenol. Our government isn't forcing us to inject our children with Tylenol. So different, so different. You're absolutely right about that, Laura, that our government is not forcing us to take Tylenol. The difference is this. If your child gets measles, your child can infect a number of people. That's why it's a public health problem. That's why I'm talking about it. Yeah, your kid doesn't have to take Tylenol, but this is a public health problem. This killed people before we had the vaccine, right? Just like other types of diseases that killed people without the vaccine. We used to die of infectious disease. That's what we have to understand, Laura. This is not some joke. It really isn't. You have to look at multiple times, even in Disneyland a few years ago when folks who are not vaccinated got the illness, and then you can spread it to others. The vaccine's 97%, but if you overwhelm people that are 3%, there's a 3% chance still getting it. You could infect others. That's why it's a health crisis. It's a public health problem. It's not like you're just sitting in your home, you're not leaving. You go to a grocery store, you go to whatever place where you eat pizza. I don't know, whatever you're doing, you're going to meet people. That's the difference, Laura. Hailu Alemu Haile says, I am amazed that there are folks against it in your country. Wow. We are having deaths because of lack of vaccine due to unavailability of healthcare facilities. Thank you so much for saying this. This is the truth. We talk about misinformation. Look at this comment. Hailu Alemu Haile. I hope I'm pronouncing your name correctly. I'll repeat the comment. I'm amazed that there are folks against it in your country. We're having deaths because of lack of vaccine due to unavailability of healthcare facilities. This is what I'm talking about. So this is so important to understand, So and Angela says it's 173 cases since October, all recovered, no deaths, 4 active cases in New York. The problem is that, Angela, we don't need a death to prove the point, right? You don't want somebody to die to say, oh, now we believe you. I don't buy that. I don't think a child should die to prove the point. Don't think so. We know that kids die from this. That is not debatable. kids die from this. This is not some misinformation. You've got to pick up a medical textbook. You've got to go to medical school or do something to find this stuff out. Can't say that, oh, it's 773 cases, all recovered, so we're all good. We're not all good, because if one kid dies, that's too many, and that I don't want that on my hands. Katie Eckhart, how are you, Katie? So good to see you. Katie's an awesome nurse that helps so many people. Lynn Daly, thank you for joining us. Dawn Sunrise, people who refuse vaccination to be held criminally accountable for those they infect. That's an extreme, opinion. I think that we need to educate, right? We need to educate. So we need to make sure that they understand what the consequences are. But I appreciate your comments. Angela, it says Angela Bush says we cannot also spread false fear. It's not false fear. It's real fear. People are getting infected. They really die. They really get encephalitis, swelling of the brain, pneumonia. This is not false fear. This is not something that doesn't happen. I'm just making it up. It's not some fable. It's real. That's why it's important to spread it. Because if we just sit there and just do nothing, I'll repeat to you, this is 2019. We're in the United States of America, most advanced country in the planet, 153 cases in Rockland County, New York. Why is that? And I think, we got to educate people and say, you know what, it's time. We got to be able to make sure that we know that we can prevent this. Hey, a lot of you are on ManyChat. If you have any comments, please give those to me. If you're not, please share this. I think this is so important for people to understand what the heck is going on. Please share this with your community and so they can understand this. Joanne Andigone, I hope I pronounced it correctly. I apologize if I'm not. The rise of mandatory enforced vaccination legislation should send a chill up every American spine. That government can force you to accept any kind of medicine and inject you against your will is totalitarianism at its worst. This egregious form of state powers metastasizing. Dr. Ron Paul. I would love to talk to Dr. Ron Paul about how he plans, if this is what he's saying, how he plans to contain diseases that are highly infectious without vaccinating folks, unless you want to just stay in your home and mandate that people have under house arrest. I'm not sure what the solution is. To stay in 2019 with the knowledge that we have, in good faith, that you should not have people vaccinated. It's just unacceptable and also irresponsible. If somebody's a medical physician and says that, then they have ignored most principles of medicine. The first one is, right, thou shalt not do harm. Right? If you know something and you're still spreading misinformation, not acceptable. So Angela Bush says, can a healthy unvaccinated child with no disease symptoms spread an illness that is not present in the child? If a child doesn't have an infection, cannot spread it. But if they have the infection, unvaccinated, they can spread it, Angela. So good comment. Ron Richardson, thank you for bringing clarity. Thank you, Ron, for joining us. Ron Richardson. Mary Ortiz, thank you for joining us. Tell us where you're joining us from. And Catherine Reardon says, all lives matter. Best know your children are at threat of measles if they're not vaccinated. You said it very well. Chantal and Tim Chisholm, awesome. All the way from Fentanyl, Michigan. I think that, right? Yeah. Angela Bush says, Dr. Nadia, there's a father in Detroit right now who's fully vaccinated and he has the measles. So, Angela, you're absolutely right. Remember what I said, 97% effective in preventing it, but 3% still can get it. That is why it's such an important conversation. When people get the disease and you increase the disease burden, then you're going to get more folks who are vaccinated who may get the disease, right? That's 3%. That's why it's important. If you've been exposed to a person with measles, talk to your doctor. I will gladly send you all the research and have all the resources. Absolutely, please do. You can go on ManyChat or send me a private message. I appreciate your information. And for those of you who are watching, please share this with your community. I really appreciate it. Joanne Antigone says measles vaccine doesn't prevent measles. That's just wrong. Joanne, that's just wrong. It's 97% effective. I don't know what else to say. So I'm not sure what else to say, except you have to read the medical books. You can't read these alternative everything. You got to read people who have no vested interest in this and show why. So Catherine Reardon says syphilis killed in the pandemic way until vaccines were passed. So, lots of infections have been prevented with vaccines. Angela Bush said we also had mass colonization with poor hygiene, poor nutrition, and very poor sanitation. Data shows a major decline before the first vaccine. You're absolutely right. Does sanitation help? Does economic improvement and nutrition, absolutely. But it still can infect people. Even if you have good nutrition, this is a highly infective agent. Understand that. Marilyn Maguna Pabayu Lingon. I'm not sure. I don't have a translator here. I'm not sure what that says. I apologize. Angela Bush says, but children are dying from vaccinations, but that's okay. I agree. No children should die. I agree with you. I just don't think that a vaccination is killing children to the same extent that a disease would kill a child. I just don't think that evidence is available, that anybody agrees upon in the medical community, that is unbiased, that are not selling drugs. I'm not selling a drug. I'm not selling a vaccine. I don't have any pharmaceutical ties to the MMR vaccine. I just don't want kids to die. We need major education, real science. I agree with you. I love that. We need real education on nutrition and immune system. 100%. 100%. Angela, we have to get, Angela Bush, we need real education, but we also have to get real information and not tell people that the vaccine can kill. When really the disease kills, the vaccine prevents. And can we get better vaccines? 100%. Let's get safer vaccines. Totally for you. But until that happens, I don't think we should just say don't vaccinate and let the disease get you. That's just not right. Laura Kiltka says, I don't think a child should die to prove a point, your words. But what about the children that die after receiving MMR? You mentioned worrying about the numbers the vaccine has protected instead of the ones it hasn't. But what has the number of poor innocent babies that have passed away following a vaccine? Do you think all those numbers were even reported to the VAERS? That alone is scary. Those numbers matter. It does. But here's the problem, Laura. So this disease is very, very infectious, and it can kill. So I cannot tell you that I would tell you that no child has ever died from a vaccine. Is it possible? Absolutely, because any drug in the planet, anything you give, can kill an individual or give you a side effect. Having said that, these medicines undergo rigorous study. Anybody who's gone through the FDA, anybody who's gone through the FDA process knows what it is involved to get a drug approved. So if these medicines killed people, they wouldn't be approved. We can't get stuff approved that we're begging the FDA to get approved because people need it. I'm telling you, it's not that this vaccine's killing people. This virus will. Definitely, if we don't do it. And it's doing it now in countries. And I pinned the comment up in the top from the young lady, I believe, who said, you know what, I can't believe your country is somebody in your country is actually, worried about not giving this. We can't get the resources to be able to vaccinate, and we're losing people. So you gotta look at that. That is somebody who's not biased in any way. They're out there saying, how can we save lives? Joanne Cafferty, thank you for joining us. Jessica Furman, are you going to answer my question? I'm not sure what your question was, Jessica. I'm sorry. I'm not trying to avoid it. I don't know what the question is. Sometimes it doesn't show up. Oh, here it goes. Why don't vaccines have to go through the same testing as regular medication? They have to go through testing as well, just like most medications. They have to go through the process for the FDA to approve it. There's not sidestepping it like it's not a dietary supplement. Jessica, it's not a dietary supplement. So you have to know that if it's not deemed safe, it would not be out there. Well, thanks, Angela. I appreciate you with being open-minded about it. So, Jessica, I hope that answers your question. And so, listen, I'll tell you that the problem is that there's so much information that's misleading. But the key is this: 97% of folks get. If you get the vaccine, 97% will be immune, right? 3% may still get the infection. So it's so important to make sure that we get as many folks immunized as possible so we can prevent this disease from really taking over and getting more and more prevalent. If you have 153 cases in New York, in Rockland County, New York, confirmed, in 2019, I tell you there's a problem. And that's why I applaud all of you for watching this. And if you have any questions that I haven't answered, please let me know. And also go on ManyChat. Please join our Healthy Work community if you like what we're doing and some of the broadcasts we're really giving you to be able to help you guys hopefully live healthier lives. So I appreciate your time. this evening or this morning or this afternoon, wherever you're at. So I hopefully give you a glimpse into what measles is and what the vaccine, how it can protect you. So remember, make healthy living a part of every day. I appreciate you taking your time out of your busy day to join us. I'll talk to you next time, all right? Take care. Bye-bye.